You can roughly calculate the WBC count by counting WBCs in few fields. The hemoglobin level plays an important role in making thickness of the smear. Experienced medical tech can tell the approximate hemoglobin level by looking at the smear itself. Hello friends, welcome to TechQuest channel. This is for the tech by your tech. In this video, we will discuss about peripheral blood smear, how to make a good smear and stain it. Peripheral smear is an important and a basic microscopic test as it can give us a lot of information about RBCs, WBCs and platelets and also parasites. Not only the quantity of the cells, also the quality of the cells by their morphology. Peripheral smear can be made from anticoagulated blood sample, finger prick sample or a heel prick for neonates. EDTA or double oxalate anticoagulants are suitable for blood smear as they make minimal morphological changes, but EDTA sample is commonly used as it can maintain the morphology of the cells. Heparin or citrated blood samples are not suitable for making smears and reading the peripheral smear because they change the morphology of the cells or the sample get diluted. Smear should be taken immediately after reaching the lab. Delay may cause changes in the morphology as these cells are very fragile. Samples can be stored at 2 to 6 degrees centigrade for longer time. Never keep the sample above 37 degrees centigrade. Clean, grease and lint free 75 into 25 millimeter size and 1 millimeter thick glass slides are used for making smears. If grease is present, they may cause granulation of RBCs and hemolysis. Grease containing new slide should be washed and dried before using. A spreader is used to spread the smear. Select a spreader with smooth edges and select by making trials and error till you get a good smear. A good peripheral smear should be 2/3 of the glass slide and having a tongue shape. Allow the smear to dry at room temperature. Do not use fan to dry them. We can label the smear with glass marking pencil. Once dried, that can be labeled with lead pencil on the smear itself. Nowadays, stickers with barcodes are available, but these are mainly used for automated staining machines. The EDTA sample should be gently mixed before taking a smear. Samples with high hemoglobin levels and improper proportion of anticoagulants, that is, more of anticoagulant and less of blood sample, are difficult to make thin smears. The hemoglobin level plays an important role in making thickness of the smear. Experienced medical tech can tell the approximate hemoglobin level by looking at the smear itself. Romanowski stains are normally used for peripheral smears. Leishman stain is the simple and most widely used stain. Wright stain gives extra color and clarity. May-Grunwald Giemsa stain is used in automated staining machines as it is faster. Fix your lab staining timing according to the stain used. A newly prepared stain may take longer time than the early prepared stain. Pour the stain to cover the glass slide and wait for 4 minutes. Then dilute with buffer. Mix gently without making scratches on the smear. Wait for 8 minutes, then wash with water and dry it. A high WBC count smear may not stain dark as they need extra stain and time. When you repeat these smears, after 4 minutes of stain, add few more drops of stain and give extra 2 minutes after dilution, that is 10 minutes after dilution. Same thing applies when RBCs are stained paler. Reduce 1 minute after dilution of smear, that can give you bright colors. How to check the smear in the microscope? Before making a differential count or making any reports, you have to scan the smear in low power. Put a drop of oil and use low power lens to scan the periphery of the smear. Look for WBC clumps, platelet clumps, and extracellular parasites like microfilaria. Make a note of it. We can also approximately recheck WBC count at low power lens. If you are using 10x eyepiece and 10x lens, count the WBCs and divide by 3 and multiply by 1000. Check 5 to 10 fields and take the average, then do this calculation. This is approximate WBC count provided there is no WBC clumps at the periphery. This is just to correlate your WBC count with your instrument count. Change to IPAR if you have any suspicious. Also select as area for differential count. It should be between the tail and the body of the smear. The RBCs should just touch each other. Selection of the area is important for identification of cells. If you are using 10x eyepiece and 50x oil immersion, you can roughly calculate the WBC count by counting WBCs in few fields. Take the average of it and multiply by 1000. That will give you approximate WBC count. Always use 100x for intercellular parasites and RBC morphology. In 100x oil immersion, count the platelets, multiply by 15,000. This is approximate platelet count provided there are no platelet clumps in the smear. Automated smear making machines and staining machines have replaced the manual methods. Differential counts are done by automated machines with 5-part counters, and smears are checked in the computer with artificial intelligence. Thanks for watching. Please write your comment to make more videos on medical lab test. Thanks for watching.